All right, good evening, everyone. Thank you so much for joining us on this smoky evening. Just have a few quick housekeeping notes before we get started here. My name is Jasper Dent. I'm the events coordinator here at McNally Robinson Booksellers in Saskatoon. This event is being held on Treaty 6 territory. This is the land of the Cree, Saulteaux, Dene, Dakota, Nakota, and Lakota, and homeland of the Métis Nation. So we're so pleased to be hosting Ryan Meili and Jane Philpott tonight. I'd like to thank them both for being here, as well as Penguin Random House for helping us coordinate the event. We'd also like to highlight the Manitou Beach Literary Festival, which is taking place tomorrow at Manitou Beach. Ryan and Jane will be speaking there as well, starting at 3:30 p.m. at the community hall. There are a number of events taking place throughout Manitou Beach tomorrow and a great lineup of authors, so we encourage you to check it out if you have the time and inclination to do so. Our focus this evening is on Jane's new book, Health for All, A Doctor's Prescription for a Healthier Canada. We have copies on the desk by where you came in, as well as up here at the signing table, which is where you'll find Jane after the conversation portion of the evening has concluded. Also on the desk where you walked in is our question box. So we won't be doing a traditional Q&A this evening. Instead, if you have a question you'd like to ask, we ask that you write it down on one of the slips of paper provided and just put it in the box, which I will then bring up partway through the evening so that Ryan and Jane can read your questions and respond to them. I also want to let everyone know that this event is being live streamed. There's a camera up front here to my left, your right. It'll be focused on Ryan and Jane for the evening. We won't be filming the audience, but the camera microphone will pick up if your phone rings during the evening. So now is the time to silence it or turn it off if you haven't already. Finally, we just want to acknowledge that the conversation of health and healthcare can be difficult and fraught for many people, depending on your personal history or that of family and friends. So we ask that you just keep that in mind and be kind to yourself and to your fellow audience members this evening. And now I will stop talking because I would love to get off this stage and welcome up Ryan Meili and Jane Philpott. Everyone, please give them a very warm welcome.
Well, good evening, everyone. Thank you so much for joining us. It is really exciting to have Jane here with us in Saskatoon. I think she needs almost no introduction, but just to remind you who this is with us today. Jane is the Dean of Medicine at Queen's University in Kingston. She's also a celebrated and well-recognized family physician who's worked for many years in family medicine, including working overseas in Niger for several years, but most famously known as the first physician ever to be the Minister of Health for Canada, also Minister for Treasury Board and for Indigenous Services Canada. And we're very thrilled to have her here with us tonight and to learn more about her vision for a healthier Canada. And what we're going to do tonight, I'm going to ask her a few questions. We're going to have a conversation, and I'm gratefully returning the favor because I got to come out to Kingston a few months ago, and Jane did the interview with me when I did my book launch there. So she was pretty kind, so I didn't ask any really difficult questions, but hopefully we'll get into some interesting places nonetheless. I wanted to start something that you do throughout the book is you share stories. You share your own very personal stories. You also share some patient stories. And I wondered if there were any of those stories, either of patients or people you worked with through your work in politics or your own personal stories that you would like to start with that really would set the stage for what people will be encountering as they go through Health for All.
Okay, thank you. And good evening to everyone. Thank you so much for coming out. And big thanks to McNally Robinson Books for hosting us. I can never say no to Ryan. So when he suggested a visit to Saskatoon for a couple of events, I was absolutely delighted. And it's really great to be here. You are so lucky that you have this bookstore. What a treasure. Oh my gosh, I just walked in the doors and thought there are hundreds and hundreds of cities across this country that would give anything to have a bookstore like this. So lucky you, that's great. So the question about the stories, it's really hard to pick one. I tried in the book, and I hope some of you have either had a chance to read the book or will read the book, but you know, it's partly a health policy book, but you and I both know that sometimes health policy can seem pretty dry. And then as soon as you start to tell a story about it, people begin to understand. So maybe I can't actually pick a favorite story in there, but one of the guests here in the audience today is Max Fine Day. I'm not sure whether people know Max. Are you like a celebrity around here? No. Okay. So a wonderful Saskatoonian. And we were talking just over dinner about one of the pieces of work that I did when I was in government, which was to lead the development of legislation on Indigenous child welfare. To be able to affirm the rights of Indigenous peoples to exert jurisdiction and have their own laws related to child and family services. And there's a story at the beginning of the chapter where I describe that is one of the stories that means so much to me. It describes one of the very first meetings I took outside of Ottawa when I was Minister of Indigenous Services. I went to Winnipeg and met with the Manitoba Chiefs. And at that meeting, a woman started to tell me about the fact that there was one baby taken from its family every single day in the province of Manitoba. And that was one of those moments in life that you'll never forget. And my jaw dropped on the floor, and she was giving a speech, so I didn't interrupt her right away. But as soon as she finished, I said, "Did you say that every single day a child is taken from its family in this province?" And she said, "Well, actually, it's a little bit more than that. It's just over 400 per year." And I don't know why I had never known that before. Here I was a minister of the government, and I didn't know that. And then she proceeded to tell me about one particular young woman who was having her fourth pregnancy, and every one of her previous children had been taken away from her literally at birth, and her only hope in the world was that when this fourth baby was born, that she wanted to spend 24 hours with the baby. And that was her dream, and she actually didn't get her dream. And as I started to understand things like birth alerts, which were and still are to some extent a phenomenon across the country, I was so overwhelmed with the injustice of it, and decided that had to be one of the things that we worked on. Because, when we're talking about health, it starts from before we're born. It starts especially in those early moments of childhood. And if we don't have a healthy start in life and attachment to our families and people who love us and care for us, then we'll never be fully healthy. And so that's a story that I hope some of you, if you haven't read it yet, will enjoy that story. It has a happy ending, that we actually were able to pass the legislation. Birth alerts are no longer legal in the country, and families have been reunited, including the woman who now has all four of her children back with her.
That's wonderful. And such a tragic story, and we see so many families that have been damaged by the child welfare system. And as a family doc who has spent time having to fight against social services when birth alerts were there, so happy that is not part of what we have to deal with anymore. There's a lot of beautiful stories and beautiful quotes in the book, and I'm going to share a quote with you. I hope that you'll still recognize it when I'm done. La fia ita seur come. And this is a Hausa proverb. Could you tell us what that means and what it means to you in your approach to medicine and leadership? And I think would have a connection to what you were just talking about as well.
Thank you. So you have to practice your Hausa. Ryan and his beautifully bilingual family, I've just had a chance to have dinner with, and it was lovely listening to them. And we also got talking about the Hausa language, which is the language that I learned to speak when my husband and I and our children lived in Niger for 9 years, which is a very large country in West Africa. And Ryan was saying, well, of course you practice in French because it's a French country. And I said, well, to a certain extent, yes, but all of the people in that, the women especially, their mother tongue is Hausa. So I learned to speak Hausa. So that's what Ryan was just trying to say. So it's actually Lafia Huarcomeche, which means that health is the mother of everything. And this is a phenomenon that Ryan and I share very much, that if Ryan, I hope you all know and can see if you didn't already know, is the author of 2 fantastic books that really elaborate on the fact that health is the mother of everything. And Ryan is a great champion of the fact that if we're going to be a healthy society, then there has to be a health lens on every decision we make. As leaders in society, there has to be a health lens on every policy of the way we organize ourselves as a society, because at the end of the day, without health, nothing else matters. And if we don't, and essentially every policy of government is in the end a health policy. It might be about housing, it might be about taxes, but all of those things actually have an impact on people's health. So the host people are aware of that.
And there's another quote that we've discussed before, physician by the name of Rudolf Virchow in the late 1800s, who was also a politician. He said that medicine is politics on a larger scale. And I wonder how that concept influenced both your decision to seek political office and serve in that role, as well as how you did that work. And in particular, how the social determinants of health would have influenced the policies that you were trying to advance.
Well, that's a great question, and it's an interesting one for you and I to discuss, because we are among not a very long list of physicians turned politicians and then turned into something else afterwards. I'm not sure what either of us are now. We're still physicians, but recovering politicians. But at first glance, some people think when a doctor becomes a politician that's a bit of an odd thing, and why would you do that? No one ever asks a lawyer why they became a politician, because people sort of see that as a natural stretch. But in fact, I think you would agree with me that, and Rudolf Virchow essentially said that politics really isn't anything but medicine on a grand scale, and that as physicians, we generally think about our relationship with individuals or with families, and we think about healing and health in that context. But it doesn't. You don't have to be a physician very long before you start to realize that actually what makes people sick and what makes them well are things that a doctor doesn't always have a lot of control over. And it's the people who organize societies and set the rules for societies, change the rules for societies, that actually have the biggest influence. And so that was what drove me into politics, was realizing that, so many of the things that my patients needed, I couldn't give them, because what they needed was a job, or they needed economic security, or they needed fairness in the way that they were treated, and that the rules of society were what was changing them. And so I found that background in medicine was unbelievably helpful in politics. As you know, as a family doctor, you get to know thousands of people, and you know so much about their lives, and you know what makes them sick and what matters in their life. And I felt like I took all those thousands of people to Ottawa with me in my brain and memory, and thought about every decision that we made and what would it actually do to impact the lives of the people that I had cared for over many years. So I think is a great background. There's an interesting chapter in the book actually about using clinical skills in politics, and I don't know, how did you find that?
I was just going to ask you a bit more about that. We've got one elected person in the House. We've got Vicky Mowat, who's our
Which one's Vicky?
provincial health critic, NDP MLA for Saskatoon Fairview. We've also got an interesting person, a public health nurse from Prince Albert, Carolyn Brostrom, who's running to be an MLA right now. And I thought it would be interesting for everyone to hear, but maybe especially Carolyn, how and I really liked that part of the book, how the experience of training into the health professions and having that approach to problem solving at the patient level translates into problem solving at the political or policy level?
Well, as you know, I think it was really transferable, the skills of medicine or health care into politics. And as I said, there's a whole chapter that talks about using clinical skills in politics. And one of the things that you'll know as a nurse is that we use something called SOAP notes. Have any of you heard of SOAP notes? It not everyone realizes that this is this magical little tool that nurses and doctors use when they're writing notes about patients. And SOAP stands for subjective, objective, assessment, and plan. And literally every time you see a patient and make your notes afterwards, you organize it in that way. What did the patient say? That's subjective. What did I find when I examined them? That's the objective part. The assessment is my best guess as to what's going on or the diagnosis, and then the plan as to what I'm going to do and when I'm going to check in on things again. Healthcare workers do that so many times a day. You're iterating it over and over and over again in your brain with every problem that you're starting to hear as a person starts to tell you what their symptoms are. You're starting to develop the rest of the SOAP note in your head and then writing it down. That it just becomes a way of thinking that you don't even realize that you're thinking that way. And I got to Ottawa and realized not everybody thinks that way, right? And especially on the assessment and plan, is that politicians aren't trained to make an assessment. They're not trained to say, this is what I think is going on, and especially not trained to tell people what they think is going on. Whereas a doctor has to say to the person, and hopefully in the right way, there are 2 or 3 things that could be causing your abdominal pain here. I'm going to tell you what those 2 or 3 things are, and then I'm going to tell you which one of those I think is most likely. And my plan is going to be, here's how I will determine whether I have the right diagnosis and when I'm going to see you again to check if I was right. And I just got thinking, wouldn't it be great if politicians did that? If they, came up to the microphone after they had a big discussion in the legislature and said, there could be 2 or 3 things that are causing, this lack of housing or whatever the particular issue is. And here's my best assessment as to what the situation is. And here's my plan. And I'm going to get back to you again about this in X period of time. Anyway, it hasn't really happened in a big way, but I'm hoping to start a revolution to use SOAP notes thinking in politics. How's that?
Continue to encourage the use of SOAP. That's a great public health message as well. I was thinking about this as you're looking at the subjective. There's so many people in Canada right now who are frustrated with access to healthcare. They tell you they can't find a doctor. Objectively, the studies have shown that it's 6.5 million people who don't have access to a primary care provider. I think we've all come to a pretty common diagnosis that things aren't working well we have a primary care problem. At least that's the assessment you've come to, is that primary care is the major problem. What's the plan? You've been talking, and there's a chapter in the book right off the bat, the Canadian healthcare dream. Tell us about this dream. Tell us about this plan.
Thank you for asking, because that's, I think, one of the parts of the book that I'm happiest about is that it gave me an opportunity to share ideas that were not my original ideas, but has given me a chance to put ideas that my colleagues in the healthcare world have talked about and known about for a very long time, and to share them with a broader audience. And one of the things that we know is that countries in the world that get the best health outcomes on a broad list of measures and do so at the most affordable cost are countries that are deeply rooted in primary care. And by primary care, I mean that long-term relationship that you have, usually with a family doctor, but increasingly with a primary care nurse practitioner or another provider, that you have a continuous relationship over a long period of time with a person who helps to coordinate your care, who helps to make sure that that you have comprehensive care. They don't just take care of a single part of your body like other specialists do, but they actually take care of all of who you are. And countries that have that for every single person in their country get the best health outcomes. That is not the case in Canada, sadly. We have not actually designed a system to ensure that every single person in this country will have that family doctor or nurse practitioner to care for them over time, and that they'll work in teams. And it's become such a crisis with now millions of people that, as you said, 6.5, it's probably closer now to 7.5 or 8 million people, because the country continues to grow in numbers. And all of those people are not getting their preventive care. Nobody's looking after their chronic diseases, and they are dying prematurely as a result. And it is way past time for us to do something about this, and to say that it is about time we become a country where everyone has attachment to a primary care home, ideally in their neighborhood. If I may, I'll share the metaphor that I love so much, which is when people say, well, that's just not realistic, we can't possibly do that. And I say, well, we actually have figured out a way to make sure every child in the country has access to a school. You can move to any town in this whole country, and your child will be assigned to a school based on their geography. Why can't we do the same for primary care? So that is my rallying cry here in Saskatchewan, the birthplace of Medicare. I want to raise the rallying cry to say that we should make sure we become a country, a province, a community where everyone has a primary care home.
I couldn't agree more. I think it's a brilliant plan and very much doable. And as you point out in the book, we would probably spend less money to get much better care. Some of the reasons that didn't happen are also part of Saskatchewan history, that we got stuck with the model of physician payments and physician ownership, and that primary care model didn't get developed, with some exceptions. The community clinic model has been very successful here, but it's a small portion of the care that's provided. I'll play devil's advocate for a little bit, though. Ms. Mowat will have a lot to say about the state of Saskatchewan schools. So there's a lot of problems with classrooms that are overcrowded, complex, bad relationship with the teachers right now. Are schools the best model?
So schools may have their challenges, but what they prove to us is that we can develop universal systems for access. The question of the quality of education that happens in those schools is a separate question, and is obviously sounds like a reasonably large challenge here in Saskatchewan, and you're not the only place in the country that has challenges with what the quality of education is. But I think it's still a really helpful metaphor, because it starts to get people's brains thinking about organizing ourselves in a different way. And it also is a chance for us to say to those who don't believe that it's possible, that there are countries in the world, most of them are in Europe, who have organized themselves that way, where literally everyone, you move to a new city, you show up at City Hall, they ask what your postal code is of your place where you're living, and they tell you that you can go to this family medicine clinic. We can do that. We have to keep our eyes on quality as well. But one of our biggest challenges is that we just don't even have that access, and people are showing up in emergency departments, as you know, without having had a family doctor, and they're being diagnosed with conditions that should have been detected much earlier.
And I think if we go back to the school question, it's actually not that hard to solve. Increasing the resources, increasing the number of teachers, there's a system in place through which you could do that. And in fact, Saskatchewan has one very positive thing. We don't have a lot of private schools. Everybody sends their kid to public school. Rich, poor, everybody goes to public school. We've got a system through which we could invest and make things different. If you suddenly want to invest a bunch in primary care, it's ad hoc, it's all over the place. It's very difficult to actually deliver that care because that system isn't in place. And one of the pieces that's really missing from that system, you talked about it as a species at risk, and that's the good old GP, the family doctor, who, like you did for so many years in your career as a family doc, is providing that continuity of care, that community-based primary care. Why are they disappearing? What do we do to bring back the family doc?
This is an enormous problem across the country. We, as you mentioned early on, the work that I'm doing now is at a faculty of health sciences, where we have a school of medicine and a school of nursing and rehabilitation therapy. So I get to live this out every day now. And we have seen over the last decade that every year, fewer and fewer of our medical school graduates are choosing family medicine. What's even worse than that is that while those numbers are going down, even of those who do choose to become trained for 2 years to become a family doctor, they finish that program and they don't want to go out and become the family doctor who takes care of the whole family from the time you're born till the end of your life. They want to pick a very narrow focus, or they want to go work in hospitals or emergency departments or something where they will get potentially paid more and have a lot more predictability about their hours. It is an absolutely massive crisis. We have programs, universities in this country. It's not a secret that Ottawa is one where last year I'm told that there were none of their family medicine graduates that were going out to join and become comprehensive family doctors, and I hear stories similar to that all the time. So we have to do something to change the conditions of work. Family doctors are overwhelmed. They are not getting the support that they need. Huge administrative burden, as you know. And I go through in the book actually about 10 different things that are leading to this crisis of the fact that people do not want to become family doctors. But the number one thing that we can do, apart from money, just money is supposedly the answer to everything, but and it's part of the answer in this case. But the conditions of work are the things that we really can fix so that doctors get the support that they need. We don't graduate teachers from Teachers College and then just say, well, just, find a few people that you want to teach with and go lease a space and buy a few desks and you'll be fine. You'll figure it out for yourself. But that's what we do to doctors is they don't get the support to become family doctors and to work in a system that's organized.
So just to shift gears a little bit, we've talked about, as Jasper pointed out, health can be a sensitive topic. We're talking about politics. Let's just completely alienate everyone and go into religion. There's a very significant part of this book in which you discuss really openly your faith and how that has informed you and how it's been a source of hope, of belonging, of meaning, and of purpose. That can be a controversial topic to tackle, especially in an increasingly secular society, especially among progressives. Why was it important for you to share that part of yourself, and why does it matter so much to talk about that as you talk about health for all?
Well, you have gone through the writing of a couple of books, so you know that it's quite a journey. As how you start out to where it ends up is quite a pathway. And as I was shaping and reshaping how I would lay out the book, health is such a massive topic you can't possibly tackle it all. I knew I wanted to talk about the clinical realities of healthcare. I knew I wanted to talk about the political realities and the social determinants, but I had this nagging in the back of my mind that there was a big piece of health and well-being that was missing, and that was what some might call mental health, but I actually think it's even deeper than that, and I think it's spiritual well-being. That the deepest beliefs inside us about what we understand to be the meaning of our lives, why we have hope, what our purpose is, and whether we belong anywhere. That those are things that are essential to our well-being. And I, thankfully, as I was trying to figure out how I would frame that, was able to draw upon this incredible framework called the First Nations Mental Wellness Continuum Framework, which was introduced to me when I was Minister of Health, actually, not when I was in Indigenous Services. And it's this incredible framework that basically uses First Nations knowledge, longstanding knowledge passed down through generations. And the people who worked on this spent years of discernment and speaking to First Nations leaders across the country, and came up with this framework. And at the very center of the framework are these 4 things that you need to be mentally well or spiritually well, and that's hope, belonging, meaning, and purpose. And when it was an aha moment when I saw that framework for the first time, it was my brain lit up to say, that's it, that's exactly what people need to be well. And, I shouldn't have been surprised that that's what the discernment process would have led to. And so I chose to use that framework to talk about those things for me personally. Um, I was really nervous, as you know, about whether to include spiritual wellness and to bare my soul in ways, because I hadn't previously talked about my faith. But interestingly, it is the part of the book that I have had the most positive feedback about. Really surprising messages from people. I mean, even I went to do a podcast with the Globe and Mail, and the producer is walking me into the room where we're doing the podcast, and she's like, "I love that whole section on spiritual wellness." Whoa! I wouldn't have, she was like, "That was the best part of the book," and it made me really happy to know that it. She said that those were just ideas that I really wanted to think about. So, um, it's been reassuring.
I think there's a lot of hunger for that right now, for all of those things, for hope, for belonging, for meaning and purpose. And often in our very fact-focused and opposition and scandal-focused world of political discussion and public discussion, we lose sight of what makes us humans. There's a quote from that section, not a quote from you. Do nothing out of selfish ambition or vain conceit, as something that really informed your faith and your vision of your future when you were a young person, just sort of discovering how you wanted to live that faith. And then you went into politics, where ambition and vain conceit are sort of the main things. How did that concept drive the work you did, and how do you avoid getting sucked into a world where it really is so me, and here's the photos, here's the inches I'm getting in the newspaper, that sort of thing.
So, Ryan, I know you well enough to know that you don't really think that that's the motivation for politics. And we could have a long conversation about, what drives people into politics and whether they retain that motivation as they go through. But I really believe that the vast majority of people decide to put their names on a ballot because they want to serve their community. They see that things are broken. They believe they can make a difference, and they're willing to roll up their sleeves to do it. And thank goodness people do that. Unfortunately, they get to this place, whether it's their provincial legislature or the federal one, or even in municipal offices, and as you say, they don't always get rewarded for their honorable intentions as to what they want to do. But I think again, it's part of how we need to change the culture of politics so that we do start to encourage people who have those honorable motivations to not be afraid of this frightening, toxic world that they see on television, and to say that if more of us talk about our political journeys as an act of service, as a place where we are not there for selfish ambition and vain conceit, but that we're actually there to serve, that we can ultimately try to change what politics looks like. And I still believe that it can be better.
Me too. And I think it is a matter of the whole which wolf you feed. And so much is set up in our reward system for the wrong kind of attention. And that we need to do more to elevate when people actually do share why they're there, share the right reasons, get into the deeper stuff, and get beneath the surface. So you stepped up. You stepped up to serve in that way. You stepped up to serve in medicine. You stepped up to serve in politics, and now in academic leadership role. And you're talking about how important it is to honor the people who do step up, wherever their political stripe. That most people are motivated by good reasons to do so. You stepped up. You also stepped away, and I want to talk a little bit about that. Stepping away is kind of a theme right now. We saw the president of the United States choose not to pursue the next election for the good of his party, for the good of his country. We've got a lot of people wondering whether the prime minister of this country ought to make a similar choice, and what impact that would have. I want to talk about your choice. You made a decision to walk away. You did so for important ethical questions, things that really meant something to you. As I think about that, folks like Joe Biden making that decision, that was not an easy decision. I thought he made the right choice, but it was kind of painful to watch. You felt sad. What did or continues to make it hard to step away? And was that worth it? And why? Why did it matter to make that choice in that way?
That's just a small question. Yes, I made it probably one of the hardest decisions I've ever made in my life to resign from cabinet. I actually didn't intend to necessarily leave politics because I actually believe that the caucus does not have to agree on every single issue with the cabinet and the government. But when you're in cabinet, you do have to be fully aligned and in solidarity. And for those of you who don't follow politics, I suspect that you've got a fairly politically.
They're not here. People who don't follow politics.
Okay, so the people who are here follow politics, I'm going to assume. So yeah, I had to make a decision. Just to remind you, for those of you who may not remember the details, the rough scenario was that the folks in the Prime Minister's office tried to influence the Attorney General to give a deferred prosecution agreement to SNC Lavalin, who was undergoing a very large criminal trial for corruption. And I happened to know the Attorney General quite well. She and I had become friends. This is Jody Wilson-Raybould. So I knew what they had done, and I had kept that secret to myself because she had shared it with me in confidence. But when the story broke, and the Prime Minister and his office would not admit that they had done something which I felt was a complete violation of the core tenets of democracy for the executive branch of government to interfere with the judicial branch of government, and in this case of the prosecution. I had to decide whether I would remain in solidarity, which would have meant that I would thought that that was okay, what had happened, or to be honest and say it's not okay. I think you handled that wrong, and I'm not going to lie about it. And so I decided that I ultimately had to step away. It was extremely hard, and there are people who I would say the vast majority of people across the country I got an enormous amount of support from. People who are hardcore partisans were the people who were the angriest at me, and some still are. But I had a few people say to me, well, you gave up a chance to be around that table, and you could have done lots more things while you're there. But I think, again, here, maybe the physician healthcare background is part of what drives us, is that I couldn't live with myself if I couldn't live with myself lying to the Canadian public that I thought everything was okay when it wasn't. And ultimately, that's a decision that I had to make, and that I feel sad about it still at times. I loved what I was able to do in government, but I also love what I do now, and I believe that things have a way of working together for good.
As you look back at that time in government, you talk about someone telling you that you can do in 10 minutes what you could do in a lifetime of advocacy. You talked about the child welfare legislation, which is a massive change. Is there anything else that you really look back on and think, thank God I was able to be part of that discussion, that change in Canada?
Well, there are many things that I was really happy to be part of, but the one that comes immediately to mind was the work that we did on drug policy. And this was, again, something to which I was driven because of my patients and because of patients who had suffered from addiction, and I understood what what had caused their addiction and why they continued to be dependent on substances. And so, you know, when we formed government in 2015, you had to have a prescription to get access to naloxone, which is this life-saving medication if somebody has an overdose. And so the very first decision I got to make as health minister was to say that naloxone should be available without a prescription across the country. And we were able to also change laws to make access to supervised consumption sites for communities that wanted to have them. And I know those are still very, very controversial topics, but I still believe very strongly in what the evidence said. All humans should have the dignity of being able to have access to care. And those supervised consumption sites, while not always functioning in the way that every community is super happy with, they save lives every single day in this country. And there are tens of thousands of people, someone's child, someone's brother, sister, parent, who is alive today, either because of naloxone or because of a supervised consumption site. And I am so happy that those people are alive. I will never know who all of them are, but they deserve a chance to live and to be able to eventually be healed from whatever the challenges that they face. But that makes me really, really happy, whether everyone agrees with it or not. It's the right thing to do.
And those decisions have saved lives. And as somebody who sadly uses Narcan and naloxone far more often than I would ever want to, the idea that in the midst of a toxic drug crisis that is killing people across the country, we would put a barrier in place of life-saving medication makes no sense, but was the policy for decades and decades. So thank you for that, and thank you for so much that you did in those roles, and they continue to do in your leadership and in leading us with the discussion with this book. I want to now pass it over to either Jasper's box, or if we're willing to think outside of the box, we could go there as well. Let's see what questions we've got. B7. B7. No bacon. What is the governance model for your primary care home? Which I think we've talked about a little bit, but if you wanted to elaborate at all.
Yeah, I'll just elaborate on that briefly. It's really interesting, as you know, one of the things that's been so exciting about the book coming out is talking to people across the country. And I get the most amazing requests, and I've had a chance to be in Nova Scotia, in New Brunswick talking about this. I get calls from, communities. Yesterday I spoke to a health council in a big region in rural Ontario that only has 13,000 people that they're caring for, but this health council wanted to get my advice on how they could achieve health for all in their community. And so people are really talking about how is this possible? Can we actually make sure every person in our community or our region has access to primary care? So because we have never designed our system that way in this country, the governance models are still up for grabs, one might say. I think the closest analogy to think of still is the school board model. That there are structures in place to organize the fact that how we will decide when we need another school because the neighborhood has grown, or when two schools can be amalgamated into one because the population has shrunk. And so in each province that will look slightly different, and provinces obviously will operationalize that. But in a province that's got a lot of rural areas and some fairly widespread population, people will say that a place like Saskatchewan, that it's not possible that you could have a primary care home in every community, but you have figured out how to make sure every child has education. So you can clearly also do the same for primary care.
And there's a real role for the community when you've got that sort of a geographically based model. Instead of now, if you're at the Lakeside Clinic, the next patient isn't necessarily your neighbor, but here you're actually having a connection. You can have your PTA, but it's the patient provider association, and you can really have that role for a community to take charge of the primary care beyond just what is provided from the health professionals. Next question. In a recent crisis in Saskatchewan, the elected leaders defied professional advice to the harm of Saskatchewan people. I assume this is a reference to COVID, but it's not stated. Our health system is under the control of two levels of government. What tips can you give us to help create a government that will deliver the health system we need? And I suppose just to add on, that can be responsive to those urgent needs of the health of the province in a crisis moment.
Great question. And I will, for those who are interested in the COVID pandemic and the best analysis I have ever read, I will point to Ryan's most recent book, which is where
That is my right.
Anyway, if you haven't read Ryan's book, it's absolutely fascinating. It's a little bit, I don't know whether it needs exactly a trigger warning, but when I read it, it was amazing the things that I've forgotten about the pandemic. And that as I read it, I was like, oh yeah, we did that. And this is the stage we were at and the decisions we were trying to make at those as he goes through every wave of the pandemic and the decisions that were being made. So that's an amazing review. And you are the one who is most deeply familiar with what that looked like here in this province. But how do we get the governments we want that will actually respond to health is a massive question. But I put the responsibility in the hands of political leaders that we will not have a healthy society. We will not have health for all unless there is the political will to do it. But I also make the point, I hope it comes out clearly enough, that political will comes from public will. And that at the end of the day, what politicians will eventually do is listen to what they hear on the doorsteps, what they hear through their polling, what they hear through their community conversations about what matters to people. And so one of the things that I have encouraged people to do, this sort of started when they have an amazing book festival in Calgary. I don't know whether any of you ever have lived there, but it's called Word Fest. And that was one of my very first places that I went on the tour. And somebody in the book signing line came up and said, can you make out the book to my elected representative or my member of provincial parliament? I don't know, are they MPs or MLAs there? MLAs. And she said, I'm going to read it myself first, and then I'm going to give it to my MLA. So I did. And so I've shared that in a few other places. So it's a trend out there. But it's been exciting because people are feeling like this is a vehicle to be able to say, here's what we want, and can you make it happen? And I actually have been really thrilled with the fact that I've heard from politicians who have read the book. I've heard from high-level bureaucrats who have read the book. And they're starting to think about maybe we actually could organize differently. So if the book is helpful in that way, then please do share it with people. But most of all, raise your voice and let your elected officials know what you want and what you expect. We are sometimes way too passive as Canadians. And if we believe every person in this country deserves access to a primary care provider, then we need to tell our officials that is their job.
That is the end of the box. That's what I read already, I swear. We've got time for two more questions, and we did discuss Jane was fine with questions from the crowd. Anybody else got a question? No, we've got lots of time to chat. Jane and I will be sticking around. Our guest celebrity Max Finding will be sticking around. And just we really appreciate you coming out tonight for this discussion. Thank you to Jasper for hosting us. And a big thank you, Jane, for taking the time to write this book. I know you put a lot of hours into thinking through how to present these ideas, and you really pulled it off. It's a great book, and I highly encourage folks to take one home and then send it on to their MLA when they're done.
I will say one closing thing is that, again, those of you who've if you've come to author talks before, I'm sure you're quite familiar with the fact that authors like to sort of shop around their books with a few select friends to read it and give feedback and advice. And I did that, of course, with several people read small sections of it, and a few people had to read the whole thing. This guy read the whole thing last summer and gave me the best. Well, my husband would be a close second. I'm not sure, but my husband and Ryan were the best editors and the best suggestions, and he took it so seriously and said, "No, this needs to be moved over here, and you need to tell more about this, and this section's boring." And so you deserve a lot of credit, and I'm very, very grateful for your kindness to doing that.
Thanks, everyone. Have a great night.
Yeah.